Hi everyone, I'm Emma Carmel, your host of Breathe TV, and today we're going to be talking to Kathryn Jackson, an amazing and beautiful breast cancer warrior, survivor, and thriver. Kathryn Jackson is an amazing, beautiful, and flawless pink power sister. We're going to hear her story today and learn about her journey and what she went through and how she learned to be her own best advocate. So before we start Breathe, I want to get you all into a space of breathing and feeling centered. When you hear you have breast cancer, for me, I just stopped breathing. That's why we call the show Breathe TV. And so I want to get you all centered in a space of just kind of being grounded and being in your heart space. And we're going to just do a series of short mantras to get you breathing and centered and heart centered. All right, so if you're driving, don't do this. But if you're not, put one hand on your belly and maybe one on your heart or on your legs, whatever makes you feel most comfortable. And you can say the words, I am safe. I am here. I am loved. My body is working for me. I know that I am still here. I love my temple. I love myself. I'm going to be the best I can be for me in this moment. And so it is. Wonderful. So tell me about your journey.
So my journey started when I was at the age of 32 in 2018. My birthday's in July. But in March of 2018, I felt a strange lump on my right breast. I was just looking in the mirror and I was like, what in the world is this?
Did you feel it? Or did you?
I did feel it. It felt like you know how a mosquito bite is and it kind of gets really hard? That's exactly how I felt. So
What made you, were you doing breast
I
examination?
was just in the mirror after I got out the shower and I was like, I just noticed it because I didn't really have a big chest at all. I was just like a C cup, but I was just looking like, it was very noticeable because it was kind of like right here on the side. So it was very noticeable. So I was like, what in the world is this? Only thing I knew was to call my gynecologist for like women problems, right? So I called my gynecologist and I go to a really big hospital in Chicago. And I called her up and she was like, well, somebody had just canceled. Can you get down here? And so I went down there and got the appointment. She was like, okay, come on, we're going to examine you. She told me to lay down on the table. And, you're used to getting that done when you're getting your pap smear and everything else. So she kind of just felt around and she was like, yeah, that is a strange lump. She was like, let me be right back. I'm going to see if we can get a mammogram and an ultrasound done. And
first I want to applaud you on feeling the lump and going, because at that age you think that you can't get breast cancer, and the guidance says you're too young to get breast cancer. It happens to women who are in their 40s and 50s. So you think that it can't happen to me. So it's one thing to see it first of all, then to take action on that. And for those who are watching, it's so important to know your body because there are all these regulations saying that you're too young for breast cancer. Women get it in their 40s and 50s, but women like us get breast cancer. I got it 32 years old. And so you have to know your body first of all. And you have to know that if you feel something really off, you have to pursue getting the right answers. And so that's what you did. So I have to just stop and tell you that that's powerful.
Yes. Yeah, because you're right, because you have to figure out like your body. So after that, like she came back in the room and said, oh, you're in luck. It's just like I felt like God was just working in my favor that day. You're in luck. Somebody had canceled because usually at the hospital I go to in Chicago, it's a really big hospital in Northwestern, but they usually have appointments scheduled out almost 6 months booked up. And somebody had ended up canceling at the last minute. And she was like, if you can get to the next building, you could get a mammogram and an ultrasound done. I was like, okay, cool. And she was like, hurry up and get down there so they can, prep you and everything else. So I went to the other building, radiology department, and she explained to me what was going to happen. She told me to get undressed. So I got undressed, and this was my first mammogram. Like I heard about the stories, what they do, but
The stories? What
yeah,
kind of
the
stories? The matching?
the
The
yes,
pulling?
yes, the matching and the pulling, and I was like, I heard about that from a lot of my relatives, and I was like, okay, they made it like me so nervous.
No, it's not that bad.
A little
It
bit.
was.
So I would have to say that was
I
my
don't want to
first.
scare our viewers
Right,
away now.
right.
know?
You do have to get it though. You do have to get it, but it wasn't as bad as what I thought it was. But I didn't know you had to get that many angles. And I saw them like kept looking up, and they kept on like going around that right area where I felt that lump. So she was like, okay, so we're gonna go to the other room to do the ultrasound. And I do have a daughter, so if you have any kids, you already know what the ultrasound is. It's like, same thing. They put the cold gel on you, and then they start rubbing around.
Right.
So as soon as the technician started rubbing around, she kept going in that spot, and she was like, and I just looked at the monitor, and I was like, wow, it's like a dark black area right there. And I was like, wow, they keep going around there. Something must be, wrong. And it was just everything was going through my head then. So then after that, she had got the lead, because like at Northwestern, there's like, different tiers of people that come down for a technician. So she got the head of the department to come down, and she kept on going around. She was like, see this right here? This is a mass. And I was like, mass?
Were they talking to you and saying what was happening?
Yeah.
Or the doctors coming in and out, and you just kind of sitting there going like, what is going on?
They were talking.
They were explaining to you?
They explained to me as they
awesome.
were going through it, which I credit them for that, because like some hospitals don't do that.
Yeah.
But they came around and was just like, okay, kept going around the little spot, and it was like, this is a mass. And I was like, mass? What does that mean? Because this is all new terminology that I didn't know.
And that's the thing too I want to talk about, because people hear, okay, this person got breast cancer, they had a chemotherapy, they had, surgery, they had radiation, but there's a plethora of terminologies that they start throwing at you, and you're not equipped. And people say you're not health literate. We're not health literate. We just don't understand cancer. Nobody says, I'm going to go to school for cancer because I'm just going to go to school and then get my, go get my comms degree. Mm-hmm. So they're saying stuff to you that's because you're doctors, but you have to say like, can you please like slow your roll a little bit? Like, can you just pause? Can you explain what these words mean? Because number one, you're panicking. You're like, what is that? Then you're hearing all these words. People are coming in the room, looking at the scan, looking at your breast, whatever. And then once you are diagnosed, there's all these things to learn. So I always tell my patients, don't ever think that you're not health literate. I think that we just aren't taught about cancer. We're taught to think about disease when it's chronic, right? When you're sick, then you worry about the words. But when you're not sick, you're not taught those things. And so, Kathryn's going to explain to you about her advocacy work, but don't be hard on yourself because you don't know something. Right. You just weren't raised to know that you're going to get cancer at 25 or 35 or 40. You lived your life, and then this thing happened, and you had to shift to the next level to evolve into, knowing more, and that's all it is.
So she explained to me that basically I need to get a biopsy done as soon as possible. And they were like, okay, well, we have one scheduled. We can have one scheduled for you next week. And I was like, wow, everything was moving so fast, And I was like, okay, whatever it is, let's just get it over with. Because when they're talking about biopsy, this is my first biopsy too. So the next week I had the biopsy. And the biopsy, they numb you up and they take out tissue samples to see if your tumor is cancerous. And of course, what other markers that your tumor would, the markers meaning that what type and, size, grade, all of that stuff. The next day, the doctor from the radiology department had called me and said, do you have a moment to speak with me? And I'll never forget, because I was at work. I had just started the new job, this job that I'm currently at right now. He was like, okay, so we did the biopsy, and the biopsy came back cancerous. And I was like, wait. Time out. Did you say that I have cancer, or wait, what?
You want to separate. You're like, what is that, the cancer someplace else? And,
right.
You ain't talking to me right now.
Right. I was like, you're not talking to me, right? So he was like, yeah, you need to schedule an appointment and send the results over, because my gynecologist had actually sent got the results, but she sent it over to an oncologist that she recommended, which was at the same hospital, Northwestern. And it just started from there. So it was like back to back to back stuff. So
can we pause? I think that we tend to like tell the story, but we don't talk about how we feel, because it's a lot to feel and process. And plus, as a mother, for me, like my first thought was my daughter. I was like, this cannot be happening. So
Same.
my daughter's now 20, right? And I did a podcast recently, and she came to be. I said I want her to be a part of it because she's part of all I do. I do it for her. And then they asked me. They said, do you want to ask your mom what is one thing she would have done differently? And she said, I wish she told me everything, and I wish she let me know she needed my help. And I was like, but you were 3, and then you were 5, then you were 10. And she said, but I wanted to help you. I wanted to be there for you. I know I was hear you crying, but you would hide from me. And I was like, wow, So I always want to go back because I think it's important. And now she knows a lot about, she's older, but I just think that it's important to let people know that if you're watching this right now and you're going through something, it's not just like, you can't disconnect from your emotions. You cannot do that because that's part of whatever you consider healing, that's part of your process, right? Whether it's talking about it, my job is to be able to share with you how I felt. And I would hope you're comfortable sharing how you felt because you're not alone in your overwhelm. You're not alone in your fear. You're not alone in your WTF is happening right now. You're not alone in it, am I gonna die? You're not alone when you're in the shower on your knees begging God to live. You're not alone. And I think that one of the biggest gifts you can give people is your authentic self. And so we really want you to know that it's okay to feel how you feel, and just part of the journey.
Yeah.
So how did you feel?
Same. I have a daughter. And
What's her name?
Aaliyah. I like the singer. That was my favorite singer. Okay.
It wasn't mine too.
Right. I would say, yeah, that was my biggest thing too, because I'm a single parent. I'm like working. I've always been just like, hey, how do we get this done? I would tell him on the phone, like, hey, how we get this out of me? Hey, how we do this? Like
you're very action oriented.
Right. So I was just like, I didn't have no time to really cry about the situation. It was like, hey, let's get this done.
All business.
Let's go ahead. And one is the biggest thing to me, which I was just going through my head was like, I know they have so many treatments, different things. I was worried about chemo. I was worried about it because my half sister, a long time ago, we have the same dad. We didn't have the same mom, but she died when she was 6 in 96 of leukemia. So she lost all her hair. So I remember her having to take chemo. So that came back into my mind was like, oh my gosh, am I going to lose my hair? So at the time, my hair was like basically as long as yours. And I was like, oh my gosh, I've never had short hair.
Isn't that funny?
Yeah.
I think that's important too because my hair was longer than this when I got diagnosed.
Yes.
And they kept saying, you're going to lose your hair. I'm like, no, I'm not. And I sit there and twirl my hair. I'm like, I'm going to put on all the different creams and cocoa butter and olive oil. And this ain't going. I'll be the only person that had chemo and didn't lose their hair. And the woman, so I had a chemo class. I don't know if you had one too, but I had a chemo prep class. And I'm like, I'm not going to lose my hair. And then I did. But for some reason, I felt ashamed for thinking that. I felt like I was being vain. I felt like, okay, should be thinking about the cancer and not my hair. But at the time, there's so many things that are being taken from you in a sense.
Yeah.
Your autonomy, the plan in your life that you had already planned. You're thinking about your child and what are you going to tell your daughter about things you guys plan to do and things you dreamed about. Depending on your stage, will you be here 3 years, 5 years, 20 years? So in a sense, your life is being not kind of stolen in a way, and you have no autonomy over what's going to happen. And so you're thinking, I just want to keep my hair. I'm good. I can just smile, put on makeup, and I'm golden, right?
Right.
And so I didn't discuss this for a long time, but I felt guilty for thinking that. If I can't control the entire world, I can control getting my hair done, makeup done. Then you realize so that you can control your mind. And then your attitude can be like the world, it can be world changing because once your mind is in a mindset of like, I'm going to live my life, whatever they tell me, then that really shifts your journey because you had to figure out, like your diagnosis, which you talked about with your healthcare team, treatment planning, all that stuff. Now, were they involved? Were they asking you what do you want, or were they saying here are your options?
So the following week, I met with a team of doctors. So the only thing I would say being a part of a bigger type of hospital, which also has a education component to it, because Northwestern University and Northwestern, they have a lot of
They're a really good healthcare system.
Yeah, they are pretty much the top. And I think because of their, ratings and everything else, they want to make sure it stays like that, right? But I would say it was a team of doctors, so it's overwhelming, but I know it was information that I needed to take in. So I met my oncologist, then she had the PA, and then the nurse navigator, and then the breast surgeon. So it was like it was in like a conference room when I first
I love that. So
it
you had a
was
tumor board.
yeah, it was
You were in the. That's amazing,
yeah,
though.
it was really good.
Because a lot of women who are younger and who are
Yeah.
Black don't have any of that.
Yeah.
And that's why you find the health disparities really popping up, because you don't get to be, you don't have a
Yeah.
team of people. You don't have
Yeah.
your team. You're not in a tumor boardroom asking questions.
Yeah.
You're just like, they get dismissed, they get delayed, they get denied treatment at the right time. Hence, so you had a really good team.
Yeah,
Yeah, what was it?
I had a really good team.
That's
So they
fantastic.
laid out all the treatment plans. They just laid out how this would work based off of my tumor. So I was diagnosed with invasive ductal carcinoma, grade 3, stage 2B to 3, ERPR positive, and HER2 negative. It's crazy how I know all that, but
I had the exact diagnosis,
Yeah.
but I was triple negative.
Oh wow,
Same
Yeah.
age.
Yes. And I was just like, so these were all terms that I'm like, wow,
What?
these are all like,
What the what?
What? So being that they do give you, they do explain it to you, but they explain it to you more in the medical terms, right? So I'm like, okay, so I'm a big researcher. I always have been. I would say they laid out the treatment plan, and my whole thing was like, okay, what we got to do to get this out of me? I was like, I just want to know what the steps are. They was like, well, you're gonna have to take 8 rounds of chemo. It's a funny story. Like, so when I started my treatments, they told me, of course, what was going to happen. They was like, you're going to lose all your beautiful hair. And I was like, I was feeling the same way. I was that vain too. I was like, no, I'm
But
gonna
you're
put
not
some
being
freeze.
vain, though. You just,
Yeah.
it's who you are.
Yeah, it was. I didn't know how much my hair was until it started falling out.
Yeah. As a woman, you
Yeah.
you think about your hair, your eyebrows, your
Yeah.
eyelashes, your breasts,
Everything,
your booty.
yeah.
I mean, your womanhood is like, this is who you. This
It's
is
like
the
taking
temple
it
you're
away
in.
from you. Yeah.
Yeah. So,
It's-
but
it was
this is
just,
why I said you were not being vain. It's just
Yeah.
kind of like, this is who I am.
Yeah, and I never knew how much it was until when I first had got my treatment done, I was supposed to have a port put in the same day, but I had drunk some tea from Starbucks and they told me you
damn.
couldn't do that.
Starbucks.
Right.
Sorry, Starbucks.
Right, exactly. I was like, oh, dang. So they told me that I could get my first chemo treatment in my arm, and usually they don't recommend that, So because I had the Starbucks, I had to have the surgery postponed. And if I could explain it, the first chemo was like, it felt like, you're about to sneeze and it burns right here. It was like that for like an hour and a half straight. And I was just like, I don't know if I could do this. I don't know if I could do this at all. I took a cold ice pack and just going like this for a whole hour and a half because it was so, like, I've never had these drugs in my body. So
Did they explain to you beforehand how you were going to feel, maybe?
They told me that I might get something, but, they just never know because everybody's different.
Did you have pre-meds?
I did have pre-meds. 2 weeks later, though, my hair started to fall out. And I was just like, oh my gosh, they were definitely right about that part.
And the way it falls out, though, it's like, it's something that you can't, like, and again, people, like, you might see somebody without hair and think, okay, this is how people look. But, like, to be, like, just scratching your hair, then you look in this hair in your hand, or go to bed and get up this hair on the pillow. Mm-hmm. You take a shower and wash your hair, and then a chunk is, like, it's just, like, something about that, the way it happens is so, like, this is really happening.
Yeah, it's so, like, real at the time, And the crazy thing is my hairstylist was doing my hair since I was 6. I was like, yeah, I cannot have my hair keep falling out like this because it's so long.
Did you end up, like, just shaving
he ended up cutting it off. And while he was cutting it off, he was like a little bit teary-eyed. He was tearing up because he was like, I can't believe we're doing this. I was like, hey, we got to get it, we got to do it,
Well, you can lose your hair, you can lose your eyebrows, you can lose your eyelashes, but
everything.
But you do whatever it takes to keep your life. Right?
Exactly. I was like, I just want to be here. But I kind of like came into my cancer self then because I was like, okay, if I'm really going to do this.
When you say cancer self, do you mean you came into, like, what does that mean, cancer self? Do you mean, like, accepting, or do you mean that you were embracing the next level of your journey, the next phase?
I was embracing the next journey of my phase. So anything that I have done out of my lifetime, I just tried to embrace it. But the funniest story is when I had 4 parts of AC because I had 8 rounds altogether. Tell you like, hey, we're gonna give you some antihistamine and different medications because it's prone to allergic reaction, right? So I was like, okay, no problem, whatever. So of course that medicine made you so drowsy. So the next day I broke out in hives.
Oh my God, wait, are you kidding me?
Yes.
So oh my God, this is so crazy. So when you think about Black women and targeted treatments, this is why it's important to be in trials, because I broke out in hives from my scalp, like my entire body it was like inside out. I would scratch for hours, and I called a nurse and I'm like, I can't live like my body's my mouth, my ears, and she's like, take Benadryl. I'm like, I already had 2 or 3 or 4.
Right.
So I take up to 8 Benadryl, which is not safe, but like they're like, nobody else complains about this. No other patients complain about this side effect. And I was like, what? How is that possible?
Exactly.
And maybe you were on that webinar there was something we were on for Tigerlily, and I shared that story, and all these Black patients said, me too.
Yeah.
And this is like, I was like 14 years out of treatment. Yeah. So those are things that make you, I almost didn't continue my treatment. I said, I cannot do this every single time. And by the way, it didn't stop. It kept having those histamine reactions. Even till now, my body just more histamine inflamed. So when you were told having the reaction, and they were like, were they responsive to you?
They were. One thing I would say about, again, my doctors were on point. They were like, hey,
# Northwestern.
Right, exactly. They came, and I mean, they told me to come down there right away. They're going to give me some medications. But this is my downfall. So my biggest issue was my insurance. Even though I had PPO. I had PPO, but because of my age, they had delayed. So my treatment plan.
Because you were under 40?
Yes. Because I was under 40, my doctors had to like submit so many like documents, explain every single thing, explain why I needed this new treatment, explain why this new drug could benefit me from, not having an allergic reaction. But they were saying it was super, like, why my insurance company was like, oh, why does she need this? And at the time, I was just like, I got PPO insurance. I'm paying all this money for this insurance, and you mean to tell me they kept on trying to delay it. So the delay happened almost 3 weeks. And I was going to get my treatments like every 2 weeks. So during that time, as you know, like having the estrogen-driven tumor, things just keep on going back up. And they like, oh, well, hey, let's start, producing even more,
That's so stressful.
Yes. So then during that whole time frame, the crazy thing is that my tumor had increased in size during that time frame of that delay.
Because you were stage 3.
Yeah. So I was like, I was closer. I was stage 2B to 3. So it was very close to 3. And my tumor was grade 3. And so they were like, okay, well, now treatment has been approved, but now after 3 weeks. So now I got to schedule an appointment. So now you're at the 4th week, right? So then after that, I had 20 rounds of radiation. So I completed my radiation in January. And of course, being at the hospital going back and forth, I had 20 rounds of radiation. So I had to go Monday through Friday for 15 minutes each. So think about it, I just started this new job, and we just became so amazing friends already that each one of including my boss, had participated in taking me to my treatment.
That's amazing.
And sitting in the car for me. Yeah, because I was like, I'm not going to pay all this money every single day just to be there for 15 minutes. Somebody could just sit in the car, and just.
What a blessing. Yeah. Some people don't have a boss that understands, or people that, or friends around, or coworkers, or even like people that understand that you have to go and try to save your life by going to the treatment.
And that's
some people don't have cars, and because of the transportation, they don't get to treatment, or lack thereof, and they could end up not getting treatment and not making it, right?
Yeah.
I want to go back to something you said earlier about being HER2. When did you begin to understand what HER2 meant, and then how that would impact your treatment options and whatnot? Because there's all these terminologies, right?
All these terminologies.
So there's different kinds of HER2 treatments. When did you realize this is the one for me, and if I have this, it'll help me get to that different endpoint?
So I had a lot of education in a way, because one of my best friends, she's a nurse practitioner, and a lot of my friends are actually in the medical field. So I kind of was just getting a lot of knowledge on it. But then another thing, I would say my oncologist and my nurse navigator, they gave me a nurse navigator to understand everything with my chart. So I just started doing a lot of research. I've always been an education person. I got all these degrees and everything else. So I've just been let me do research this, let me research that. So I started understanding the different markers and type of, they tell you that there's so many different treatments, but The problem I see is that you never know what the treatment is for you.
The best for
You
your body
know?
type and your
Yeah,
yeah.
for your body type. And I've always had like allergic reactions to like a lot of modern medicine. So they don't give you a lot of that data, that says like, hey, this might go this way. They just
This
give you
might
the
trigger
regular.
something else.
Yeah.
Yeah.
They give you the main side effects, but they'll never give you the, hey, I'm the always that percent, that 3% that says like, oh, this 3% only people have this, but I'm
That's
always
you.
that
Oh
3%,
my God.
right? And so I was starting to understand just what treatment plans they laid out, in which, you know, I would say that, doctors have a amazing job to try to just figure out different things because they never know.
So since you are such an expert and you're so like good at
Yeah.
this stuff, like what are some things that would make you have to change your treatment plan, and how can you be a part of that journey so you're not like
Yeah.
sitting there going like, what's happening right now?
Yeah. So I would say the side effects, I'm one of those people that I call my doctor with every little thing, or even my chart. So they have the technology with my chart. You can message them and they get back to you within like 24 hours or even less than that. But I would say I'm the side effect. I feel like I'm the side effect queen, they look like. But like, as African American people, we always be like, oh no, go do that. Oh, drink some ginger ale. You good. Okay.
I'll
Go lay
pray.
down. Right. I'll go pray.
Don't
And I'm
claim
like,
it.
right. Like, don't claim that though, but I feel like anytime you feel something, you need to go. Like anytime you have a side effect, you just need to call your doctor. And that's exactly what I did when I had that side effect.
That's powerful. And so
Yeah.
like knowing if it's like, whether it's like a histamine reaction, whether it's a lot of nausea, whether it's headaches, whatever that might be as a side effect might be, it's important because you don't know if it's something that's really, really, really bad, or it's because you're not having the best treatment for your body, or because you might think it's so bad, I can't do that anymore. You may
Right.
stop treatment, then that's a whole other conversation, right? So just knowing your doctor is aware of what you're going through, they can help you to give you some medication to overcome the side effect, or they can say, you know what, that's
Yeah.
not the best one for you. Try this other option, right?
Right.
And you talk a lot about before in the pre-interview about medications being more effective for patients because
Yeah.
each person's body is different. We know as Black women, there are not enough Black women and brown women in clinical trials, which leads to us having treatments that are not designed for our bodies, which lead to more aggressive breast cancers and other cancers. Also, it could lead to a higher mortality rate. Tell me what do you think should be happening in terms of like making medicines that work for our bodies?
Yeah, I feel like I went through a lot of things, and I would say if I fast forward, like I had a double mastectomy in 2000 because my cancer came back. And that was because my cancer had came back on the right side all over again. So before that, I had the biopsy, all that to determine that my cancer is back now. And I'm like, how is this back when I just did all this stuff? And so I was like, okay, well, what's the
So
drastic
you already
route?
had you had a double mastectomy before it came back?
So I had no. So I had, after I finished all the treatment, going through that whole year. So think about it. I finished radiation January 2019. Then they tell you like, hey, you're gonna do hormone blockers, and I tried to deal with it for the whole year. Of course, the pandemic happened. So then
yeah.
my scans had got delayed until about, I want to say, August of that year, about August, because I usually have my scans done in May. So I want to say August, maybe September, right? September, I had my scans done. And then the same look all over again when I first had got diagnosed was back all over again. They was like, okay, now we're going to have to get another biopsy. So I was like, okay, what the heck is going on? So then I'm thinking like all in my head, like, okay, how's this coming back? My scans were clear when I had radiation and everything else, but now we're in 2020 and I'm getting scans done all over again, and now you're telling me the same thing. So I was like, okay, maybe I should just go a Jurassic route. So then I get the plastic surgeon involved because they have to deal with reconstruction.
Right.
And now my whole team of doctors coming back again. My whole board is saying like, hey, let's go to this route, the Jurassic route, which is the double mastectomy.
Got it.
And they told me the type of surgery, if I wanted to have reconstruction, it's a long process. It's a 12-hour surgery. And I was like, 12 hours? What? So I was like, wait, I'm going to be knocked out for 12 hours. Can you really do that? Like, I just want to know if y'all are safe doing that. Here's your track record. You know?
Right. Yeah.
And the surgeon that I had, which was really, she was the top there breast
It's
surgeon
important to ask the questions too, though, so you're comfortable in what you're doing.
exactly, because you don't want nobody operating on you that's just got
And
out
it's
of
your
school.
and it's your right to ask. You have your right to know about who they
Exactly.
are, their experience, success record, and also their
Exactly.
bedside manner. Do you feel comfortable that you're putting
Yeah.
you're putting your life in this person's hands?
Yes. And I'm very like, I think another thing too, like some people are like very like standoffish, just listening to what that. I'm very like push backish. And I'm like, okay, what are you about to do? Are you gonna make me look good? You're not gonna mess me up. Like, what they were gonna do is the breast reconstruction. So they're gonna take out the tumor and take out all the breast tissue, which I had a double mastectomy with immediate breast reconstruction. It's called DIEP flap surgery.
flap, yeah.
D flap surgery. Yes. And so they took like, I didn't even have that much like skin or whatever, but they had to like, they made it even tighter. So they gave me like a mini tummy tuck.
Girl.
And oh my gosh, I didn't know. So January, the end of January, like January 26, 2021, I had that surgery and I was like, oh my gosh, I do not know how people go through this. And because I had 2 drains at the top and I had 2 drains at the bottom, because what they did was transfer all the fat from different parts of my body. And they had to take it mostly from my thighs. I was like, yeah, you can give me the thigh gap. And they put it all up here. And they did all the like they took away my nipples. But I was like, I'm fine with that, whatever. I was like, I just want to be here, So 2022, right the day after Thanksgiving, I had to go get my scans. I had COVID in like September 2022. I felt really bad. It was like 3 weeks I had to get over COVID. It was bad, bad, bad. November 2022, went back in to get a scan, and then everything started happening from there. They saw something on my thymus gland. And so I had to see the thymatic surgeon, which I already had, because they were kind of monitoring that. And they was like, we'll just take it out. So upon me going into seeing him in November on his doctor's visit, I was like in a lot of pain underneath my rib cage. And he was like, you're in a lot of pain. Like, what's going on? I was like, I have no idea. Like, I've just been having a lot of pain right there. And he was like, well, what I'm going to do, it looks like it might be we don't want it to be your appendix. So I'm going to try to have an emergency CT scan done. He calls me later on that evening. And he was like, yeah. He was like, your appendix, it wasn't your appendix, but it was something was going on with your liver. And it's very alarming. And I was like, liver? What do you mean my liver, right? And he was like, I'm going to send this results over to your oncologist because he's the one that ordered it. And so my oncologist called me the next day and she was like, yeah, I need you to come down to Northwestern. And I was like, okay.
Oh boy.
So I was like, oh my God, what is going on? And at the time I was supposed to be going to DC for a conference. And I was like, oh my God, I have to go to that conference like this week. I need to get on a plane. So what do you need to tell me?
Right.
And she was like, well, right now we see 2 lesions in your liver. And I was like, what are you saying? Like, she was like, we think your cancer has spread to your liver now. And I was like, wait. I don't have no time to deal with this. I gotta get on the plane.
Got things to do.
Let's figure this out. Just send me everything. So I was like, always like, bam, I need to go. She told me that I'm gonna schedule a biopsy when you land. And I was like, well, I land in the evening time. She was like, the next day we're gonna have to do a liver biopsy. And liver biopsy, they have to, sedate you and everything else because your liver, they put the little puncture. So yeah, so then that's how the process started with me learning that I was metastatic. So same thing, they called me, biopsy, they called me the next day, was like, yeah, it's 2 main lesions in your liver that's cancerous. Then I went to get another CT scan that, you had to sit for like a couple of hours for everything to go in you. Radioactive dye going in you. And then they said that you have a lesion on your right hip bone. It's back on your right side. And then on your left side, like close to underneath your arm. And then the main 2 ones they want to focus on is the liver. So, and then it was like,
it's a lot to digest at one time.
Yeah, it was a lot to digest.
And then also you had done, so I also want to make sure that the audience, watching, Kathryn, you just even hearing you talk, it just makes me like, you did all the right things. You knew what to do. You knew when to do it. You found your healthcare team. You found a team that was freaking, like epic. You could ask questions. You got what you needed. You knew about treatment planning. Mm-hmm. You changed when you had to change. You had an insurance split, but then you got that. But you did all the right things. So people always think, well, when they get diagnosed, what did I do wrong? what did I miss? What if I done this sooner? What if I made that decision differently? Sometimes it's just nothing that you did wrong. It's just what it is. And it's not acceptable. It's not okay. You don't like what's happening. Like, I didn't like having triple negative breast cancer. I didn't like not having treatments, not targeting my body. I didn't like being told I could die in 5 years. I didn't like being told that I could leave my daughter without a mom. I didn't like that I've never had targeted treatment in my entire 17-year journey, or being asked to be in a clinical trial, right? So these are not things that we ask for, and it happens despite you being educated, empowered, being your best advocate. People say, well, I didn't, I could have done better. You do better when you know better. And that's what you do. And you did all the right things. And so I just really applaud you for like just listening to you makes me like super emotional and proud of you. I know it's hard. I know you have a daughter and you're like, what's gonna happen?
Yeah.
But I know and trust you doing everything you can to move through this in a way that is empowered. And you recently joined our angel advocacy program.
Yes.
How is it going?
Everything is going good. I met so many amazing people, such as yourself. And
Other patients that are
yes, other patients. It's like a big, like when you become a part of this, I said breast cancer, the breasty community, you meet so many people, so many similar diagnoses, and like so many different things. We bounce off each other. Like I know so many people like in different areas, and they've been very helpful because I feel like, I know certain places might have different types of treatments or different things that you can try. Like even now, like I said, the biggest thing for me is I had really good insurance. It's just they delay so much stuff, and that is like the biggest thing with me about advocating is, look, I need the insurance companies to understand, like, hey, you're delaying progression, and
yeah. So you're
it's
thinking
just,
about like healthcare policy,
yeah,
right?
healthcare policy, yeah.
This bill got passed. The Comprehensive Cancer Survivorship Act, CCSA, was actually introduced by both the House and Senate. And the cool thing about it is that they recognize the importance of survivorship. It means that if whether you're early stage or not, or metastatic, they're going to put in place things to support your journey because
Yeah.
Cancer never really stops. Even if you're NED, like you're NED for like what 3 years and it came back.
Yeah.
I've been 17 years. God knows, hopefully never, but you just never know that whether or not you have active disease. You need navigation, you need better insurance, you need somebody advocating with you, you need community.
Yeah.
You need to get your mental health taken care of because our mental health could be jacked sometimes. I need acupuncture because you're so like stressed out.
Yeah.
You think,
Yeah, you
well,
are.
I have cancer, I'm supposed to be stressed out. You don't have to be stressed out all the time.
Yeah.
It's not going to help you get better or help you live a better quality of life. Your kids need support as well.
Yeah.
So this legislation is going to really help provide support for people like you and me, whether or not you're a year. Because what happens is when you have treatment, then once you're told you're fine, you're kind of dropped out of that active, watching into primary care. But then you're vulnerable because you don't have someone watching you all the time. So that's so important. I love that you're getting involved in policy. It's hard to make the best choices when you're in a state of shock, right?
Yeah.
And so one of the things that I really admire about you is that you took your business mindset into your treatment, right?
Yes.
You made it your business to know all about
Yeah.
cancer. So tell me, as we close out the episode, like how are you helping to empower other women to know their bodies, to know their health history, to know how to pick the right doctors, to know what to do as they're navigating this journey that we call life while living with cancer?
I think the biggest thing for me is not about spreading the word. It's about having, just like I said, the insurance companies understand that delaying different things. And they're just thinking like, oh no, we need this paperwork, we need this. But
Policy.
the policy part is what needs to change. And also, I really, really wish, I know they just lowered the age for the mammograms
To 30?
Yeah. But I'm like, that's still
It's
not.
still not. It's,
Yeah.
You know what's, so you know why policy is so I first began this work, I was in policy because that's when you make the change. So when that came out, I did a whole piece on LinkedIn about thank you, but not so much. So we've been asking for this as a community of women who are younger. I've been asking for 17 years to make the age. Now it's people have died in that time frame because the policy wasn't, the guidelines were not changed. So I think that for us, people like you and me who are watching, all of you, whatever's touching you, her or me, is touching your life as well. And your daughter, our daughters, your daughter's sitting over there watching this, and it's important to get her advocating as well. And so thank you for all you do.
Thank you. Thank you.
Hi, everyone. Thanks for watching. Kathryn's so amazing. It was a pleasure having this time with her. She inspired me, as I'm sure she's inspired you as well. And we'll see you next time on Breathe TV. And I'm your host, Mayma Carmel. Thanks for being here.